Bonjour à toutes.
Hello everybody, and welcome to ODESS, the house of the Pierre Fabre Foundation in the town, the southwest of France. I am very happy to open the 5th conference of the Observatory for e-health in the southern country. It was created in 2016 with the active support of the French Agence for Development and the Universitaire for Francophonie. In the current context of COVID crisis, we know that we have to operate with a number of restrictions and borders being closed down. However, we were able to continue our work because we thought that it was all the more important in this period of crisis, and we did so by leveraging all the potentials of digital solutions. So we have changed the format of this conference with a combination of people being here and people being remotely. We also have a strict sanitary protocol, and we also have strengthened communication means, which will make it possible to dialogue with 10 of our speakers. The observatory works all year long to try and spot but also document initiatives in e-health in Africa and in Asia, which make it possible to concretely improve access to healthcare for populations, especially the most deprived population. To date, there are 160 initiatives in 80 different countries that are listed on the database of our observatories, which you can access on ODESS.io. 34 of them received awards from the observatory, and 5 laureates will be showcased today. Our objective is to help with the development of solutions, but also of their ecosystem. So we try to disseminate knowledge and best practices, and we try to align those innovative solutions with public health priorities. Now, this year, COVID crisis was first on the agenda, the world agenda, but also our agenda. Since this spring, we've been following very closely the adoption and development of digital innovations in the context of the sanitary crisis. So this will be one of the hot topics of our conversation today during this conference. Before I give the floor to Mr. Kempf first, a representative of AFD, then Professor Slim Khalbous, Rector of AUF, I would like to wish you a very fruitful conference.
Bonjour à tous.
Hello everybody, my name is Pierre Kempf. I work at the Health Division and Social Protection for the Health Agency, and also I'm a focal point on a number of e-health topics because I'm a stand-in for Anne Roos, who is expecting a baby. This morning I'm very delighted to share a few words of introduction with you. So this day will be dedicated to digital in health. I have a hard time saying digital health because I think it's a poor translation of e-health, and digital health for me sounds like robots health. First and foremost, I would like to thank our host, the Pierre Fabre Foundation, and especially our General Director, Ms. Garrette. This year, I do realize all the hurdles that we had to overcome, also the uncertainties, before we were able to take part to that meeting today. And obviously, it's a massive success, so I would like to thank all the organizing team. So it's a day during which we're going to exchange, but we are also going to showcase a number of projects, a number of innovations that were handpicked by the association, by the foundation. I would like to thank the teams, but also the sponsors, and as you will see, those innovations are definitely quite passionating. Well, COVID-19 crisis is first on the agenda, is a massive source of concern, is also in all media. Obviously, it's difficult not to talk about this sanitary crisis today. So it has been, and it still is, a world crisis. All health systems were shook at their base, and we need to remain humble and clear about this. On the other hand, the crisis did shed some light on a number of challenges, and I think it's going to demonstrate the interest of digital tools in the framework of such crisis. More generally speaking, I'm going to discuss three aspects that became clearer during this sanitary crisis pertaining to e-health tools. Of course, how we manage epidemiological data and all connected subject matters, operational management. You know that because of a crisis, we had to coordinate care, to manage appointments, to provide test results. So there was a definite operational side to the crisis management. And also ITCs were very important to inform, prevent and alert. However, the crisis also highlighted that the road ahead is still very long and with many hurdles. A few more points that I think are very important to tackle with you. First, I think there's a political framework that we need for it to structure those digital tools. This political framework should aim at superimposing different different public policies. We need to have a very strong will from the national government, but also the regional organizations or the world organizations, and also NGOs. Those need to create the proper platform for the right development and for further experiments, because obviously it is impossible to have such technologies between widely accepted without such a framework. We also need sponsors, financial sponsors. Becoming digital means an investment which requires also underlying social transformations. To do that, EFD has a number of tools, financial tools, so we can help entrepreneurs through personalized support. We can finance the development capital via our subsidiary Proparco. We also have financing to a kickstart and an incubator as well. And we have a platform of entrepreneurs which is named the Digital Africa Platform. Third point that I would like to mention, I think it's important to work collectively. It's important that we have a network. You are representative of this network here and also remotely. This is really our essence. This is the energy that helps us moving forward when it comes to digital. So once again, congratulations to the foundation, but also to other players who have played a major role in that. AFD is proud to have helped in this collective endeavor. This year, we renewed the partnership contract that we have with the foundation, with Ms. Garrette and my colleague Perrine Bonvalet. We were able to continue this partnership, and I would like to thank both of them. Now, before I conclude this introduction, maybe I'm going to say a few words about AFD. So AFD stands for the French Agency of Development. This is a public body which finances development projects. We intervene in 109 countries. In 2019, we financed more than 1,000 projects for a total of more than 14 billion euros. Those projects fall in different categories, be it in the private sector, in the energy field, urban development, sewage, social protection, education, to name but a few. If we want to break down the support that we provided to those different areas, about 5 billion of loans to the states, 5 billion of loans for companies and collectivities, 2.5 billion as subsidies for projects, and 1 billion as guarantees and participations. So this is how we used up our budget last year. 50% of those subsidies and loans are targeting Africa, which remains a continent which is very close to our heart. Once again, I would like to thank from the bottom of my heart all the players at the foundation, and I would like to wish you again a very fruitful day of discussions. Thank you very much.
Monsieur Slim Khalbous, peut-être.
Mr. Slim Khalbous is going also to provide an introduction to this conference.
Merci beaucoup.
Thank you very much.
Merci.
Thank you for giving the opportunity to AUF to take part to this meeting. AUF has been a long-standing partner to the foundation, especially to the eHealth Observatory. We've been one of the founding partners, and I hope this will be the case in the future going forward. And we're delighted to see that this smaller project has now become a reference platform, and we're very proud of this. Now, a few words to present what AUF is, then I will give you a few examples of what we do in the fields of health and digital. We are not an association specialized in health. We also have a number of projects in the areas of research and education. And finally, in the third part, I will tell you what we do in the framework of the COVID-19 crisis. So AUF stands for the Association for Francophonie. So this is an association which helps with networking, which also leverages the different projects of research worldwide. So we support French-speaking scientific communities and how we can disseminate scientific research thanks to the French language. We are considered as the first network of universities in the world with 1,007 universities from 109 countries in the world. And this, of course, means a lot of responsibilities for us, and we strive at helping South-North relationships. We do many things in different areas connected to university, research, education in general. We focus very much on digital in health sciences. I'm going to give you a few recent examples of projects that we've supported in the last years or so. First, we help and support expert networks. Expert networks, as the name entails, we have a network of medicine schools in the world. We also have a network of different pharmacy deans. We also have a network of different dental schools. And in this network, we support a number of projects. We help with the accreditation of schools in countries of the South. For example, the Marrakesh Dental Schools was accredited in 2019, the one in Marrakesh and the one in Tunis the following year. And these were some of the endeavors of the AUF. We also help with remote learning platforms. We have programs with a number of universities UNESS, which is the French University for Health and Sports Health. And we also help with the development of a number of universities. For example, the Medical University in Haiti. We have a collaboration project whereby we try to have a digital division. So we're very present. There are a number of MOOCs that are created and disseminated thanks to AUF support. When it comes to education sciences, we also co-created associations or bodies. For example, in Laos, we have an association for French-speaking medical schools, and we work strongly with people in the country to have this institution become more digital. In the area of research, we collaborate with a number of bodies, to name but a few, with a counterpart in Quebec, to help access to care. We also help with research and development with IRD in France, for example, and then again we disseminate a number of educative material. We can also support the publication of books or magazines, for example, the French-speaking magazine. We also organize scientific events like the one you are attending today. The last big meeting that we organized was a colloquium in Brussels in 2018, where the main theme was the role of education and education to health and the contribution to health policies. We discussed back then the importance of e-health and e-health tools, which demonstrate, which is a topic in which we've been interested for many, many years. We also have a number of structuring projects in Morocco with the Health Ministry. We have a project whereby we want to help 1,000 radiotherapy technicians. We also have, still in Morocco, we support the Advanced Studies Institute on the impact on health of urban development and access to digital tools by the population. In the Ivory Coast, we also have another example. We're very proud of the creation of the virtual University of Côte d'Ivoire. So we supported the entire project, and we're also creating a Fab Lab in medical sciences. So this was an overview of everything that we do, the fact that we invest very much in digital, in science, health, in health science in general. Now, a few last words on what we did during the during the COVID crisis. Very quickly, we launched a crisis mitigation plan. We implemented telework or remote working for our employees, and so we used the tools that we usually use for our partners, and we used them in-house as well. We had 4 pillars: scientific training. So we had a newsletter which we sent on a weekly basis, and we would showcase all options and all projects that were available around the crisis management. Then we had a second prong: documentation. So we have a library, and this library is fed with everything that was published. This was a digital library which was in free access for all the members of AUF, and we had quite a number of people taking advantage of this free access to the library. The third prong was training. We made it possible for close to 1 year, for close to 1 year, in the last 12 months or so. We opened digital platforms which make it possible for students from the south to use that platform and make classes and courses available to their students. So a number of online courses or classes. It was a tremendous success. We have more than 800 such classes available. 40 countries use this platform the world over. But also, university in the north also develop classes and trainings for the south. So we have these double specificities of having this platform which is managed in the north, but we also have the possibility for students or researchers who cannot go to their university, and they can help with all bureaucratic tasks, registration, etc. For exams as well, there are digital centers, and also for students who do not have the financial means to have a high output internet connection, they can use the French-speaking campuses. So campuses where they have free access to computers and wideband internet. So thanks to that platform, we're able to deliver a number of MOOCs and certification of different diplomas. So the diplomas that are delivered by our universities are safe and fully recognized. The fourth prong, we also launched a call for projects in research and development. So this is a call to students, PhD students, and young engineers. And so what we'd like to do is help them, support them technically, but also financially, to develop tools with an immediate impact. At the beginning of a crisis, you may remember that there were no masks, that we did not have respiratory equipment, and so back then we needed to have such projects to potentially leverage what was already existing and maybe duplicate projects. So there was this call for projects. It was extremely successful. We had more than 2,000 people who applied from many countries. The fund was more than 1 million euros, and we were able to finance projects from more than 40 countries. So this is what we do. This is the reason why we're very happy to be here. We're happy to support, but also be a partner of this observatory. And the topic today, I think, is very topical, and will be more than delighted to talk with all participants. Thank you very much again for inviting me, and have a very nice day. Thank you very much to Dr. Khalbous. Welcome once again to this new installment of his Observatory of e-health in the southern countries. So this is a very different installment because most of you are connected remotely to a platform. It was impossible for you to travel to Lavore and be with us today. However, thanks to technical solutions, we're all going to be together nonetheless, irrespective of what or where you are today, in the United States, in Africa, or in Asia. This conference is maintained, and this is good news. I think it is the most important point, the fact that we can have those new technologies presented to us, and for us to realize that we've made progress year in, year out. We'll see how those digital tools are very much relevant to fight against sanitary crisis. This can be COVID, but also dengue, Ebola crisis, and obviously we didn't wait for COVID crisis to have tools and to have way to mitigate such crises. So here we have a partnership with AUF. You just heard their representatives, and we are very fortunate to have people from the world over listening to us. So we're going to congratulate, for example, the campus in Brazzaville, the campus in the Great Lake region in Burundi, in Gaoundéré in Cameroon, in N'Djamena in Chad, in Kinshasa in the DRC, also in Lubumbashi, in Libreville in Gabon, in Libreville, also in Cotonou, in Ouagadougou, Abidjan in the Ivory Coast, Conakry, Bamako, Mali, Nouakchott in Mauritania, Dakar in Senegal. We will have a presentation. Lomé will have a presentation also from Togo. We'll have a presentation from Laos, from Vietnam or Cambodia. So there are many people taking part remotely to this conference. And as I said, we're going to start with a presentation from Laos with the campus from Vietnam.
Okay, Vientiane, we will have Antoine Longvis. Can you hear us? Can you hear us from Vientiane in Laos? Yes, I can hear you loud and clear. How many people are you with, and what is the weather like? What time is it? It's 3:30. We haven't had much rain today. How many people are you with? How many people are you with? Now, who came to attend the meeting? Are they students, caregivers, people are just interested in IT? Well, we are happy because we didn't expect to have that many people. We have, of course, students, we have midwives, we have medicine students. So we have a wide variety of public, and they're all interested in e-health. So we also have teachers and from the pharmacy university. It's great to have meetings broadcasted in several countries. Now, this is broadcasted in French and English. You can select the language in which you want to have the meeting. So, Antoine, what is your expectation? What are the expectations of your guests? I think the subject of the meeting is obviously very attractive, and it's, follows current events. We have not had any COVID cases in Vietnam for over 2 months. But we do know that people are concerned, people don't want to leave their homes. And we know that countries such as Laos are very much concerned. Thank you. Thank you so much for being with us, and we'll see if you have questions at Vietnam. Now, for all the other people following us on the internet, if you have comments, questions, positive points, it's always good to have your chat comments. Very heartwarming to have all these messages. I have a first message that says, hello, we are the group working against sickle cell disease. Thank you. Then we also have a hello from Kinshasa. We also have Professor Auger from Niger. We are at the Health Center of Niger. Now we also have messages from Casablanca. So, we are followed throughout the planet. This is, of course, a conference that concerns everyone with the pandemics. So don't hesitate to say hello. It's always good, and it's a ray of sunshine.